Good morning, everyone, and welcome. I'm glad to have you all here today. We are about to begin a presentation on MOH, TB, leprosy, and other lung disease prevention and control. Today's session is titled Adama, and it took place on Yekatit, 2018 EFY. Over the next few slides, we will explore various strategies and efforts to prevent and control these important health issues. We'll cover key topics, including prevention methods, control programs, and recent developments. Let's get started and make the most of this session. By the end of this session, participants should be able to understand the global burden of tuberculosis, including how widespread and impactful it is worldwide. We'll also discuss the strategies and priorities of the Global End TB Initiative, which aims to eliminate TB as a public health threat. Additionally, you'll learn about the current performance of TB control efforts at the national level, and we'll explore the missing TB case finding strategies specifically in Ethiopia. These objectives will help us connect the broader global efforts with local challenges and opportunities, giving you a comprehensive understanding of the current landscape and what needs to be done moving forward. Let's take a closer look at the global TB situation. Tuberculosis remains a major public health challenge worldwide. Despite advances in medicine and public health efforts, millions of people are still affected each year. It's important to understand that TB is not just a problem in low-income countries. It affects all regions, highlighting its status as a truly global health issue. We see that the burden of TB is significant, with a large number of cases and deaths each year. This underscores the need for continued vigilance and innovative strategies to combat the disease. By understanding the scope and scale of the problem globally, we can better appreciate the importance of coordinated efforts, research, and resource allocation to eliminate TB as a public health threat. This slide sets the stage for discussing specific challenges and solutions in the fight against TB. Ethiopia has a population of approximately 132 million people, making it a significant country in the region. It's also one of the 30 countries worldwide that bear the highest burden of TB and TB/HIV co-infection. The TB incidence rate here is about 141 cases per 100,000 people, which indicates a substantial public health challenge. In 2024, we estimate around 186,000 new TB cases, with a confidence interval ranging from 97,000 to 302,000. This reflects the ongoing need for effective detection and treatment strategies. Looking at the national situation, these figures highlight the importance of targeted interventions and sustained efforts to control TB across the country. It's a reminder of how crucial it is to integrate TB control into broader health initiatives, especially considering the impact on such a large population. This context sets the stage for understanding the scope of our work and the importance of strengthening our response to TB in Ethiopia. Let's take a closer look at the current situation with multi-drug-resistant or rifampicin-resistant tuberculosis, often called MDR or RRTB. The estimated incidence is about 1.9 cases per 100,000 people, which translates to roughly 2,500 new cases each year. Of those, a small percentage, around 1%, are new cases, while about 11% are among people who have been treated previously. This highlights the ongoing challenge of drug resistance and the importance of effective treatment strategies. Now, when we consider TB in people living with HIV, the numbers are also significant. The TB incidence in this group is estimated at around 12,000 cases, with an incidence rate of approximately 9.3 per 100,000 population. This underscores the close link between TB and HIV and how co-infection complicates both diagnosis and treatment. Overall, these figures emphasize the continued burden of TB, especially among vulnerable populations. They remind us that our efforts need to focus not just on reducing new cases, but also on managing drug resistance and supporting those living with HIV to prevent TB co-infection. These are key points as we work towards controlling and ultimately ending the TB epidemic. Let's take a closer look at the mortality rates associated with tuberculosis. Currently, the TB mortality rate stands at approximately 14 per 100,000 population. This translates to an estimated 19,000 deaths worldwide, though the range can vary between 9,500 and 31,000. Now, when we focus specifically on people living with HIV, the situation is even more concerning. TB causes about 2.1 deaths per 100,000 among this group, which amounts to roughly 2,800 deaths, with estimates ranging from 1,500 to 4,400. These figures highlight the significant impact TB has on vulnerable populations and underscore the importance of targeted interventions. Understanding these mortality rates helps us grasp the gravity of the TB burden and reinforces the need for continued efforts in prevention, diagnosis, and treatment. Let's take a closer look at the scenario for the increment cases. On the one hand, we have some possible good explanations. For example, increased investment in healthcare can lead to better detection and reporting. Improved lab capacity also plays a crucial role, allowing us to diagnose cases more accurately and efficiently. Additionally, active case finding, including community TB care and screening for TB and COVID, can significantly boost notification numbers by reaching more people who might otherwise go unnoticed. On the other hand, there are some explanations that are not so positive. For instance, postponed demand due to COVID might temporarily reduce notifications, but it can also cause a backlog of cases that get diagnosed later. An influx of returnees from Arab countries, along with internally displaced persons living in congregate settings, can increase transmission and case numbers. Drought in certain parts of the country can weaken health systems, and ongoing war and conflict further disrupt health services and surveillance efforts. Finally, when we look at the trend of TB case notifications at the national level, these factors combined can cause fluctuations. It's important to interpret these changes carefully, understanding both the improvements in detection and the broader social and political challenges that impact TB control efforts. This helps us see the full picture and plan more effective interventions. Let's talk about TB case notification. This is a crucial aspect of understanding and controlling tuberculosis. When we mention case notification, we're essentially referring to the process of reporting new and existing TB cases to health authorities. It's a key step because accurate notification helps us track the true burden of the disease in a community or country. By collecting this data, health programs can better allocate resources, plan interventions, and monitor progress over time. It also allows us to identify hotspots and vulnerable populations who might need targeted support. An important point to remember is that case notification isn't just about numbers. It's about real people affected by TB and ensuring they receive appropriate care. Reliable notification systems are fundamental to effective TB control because without accurate data, our efforts can be misguided or insufficient. So, maintaining robust case notification mechanisms is essential in our overall strategy to reduce TB incidence and eventually eliminate the disease. All right, let's take a closer look at this slide. Here, we're emphasizing the importance of understanding the core concepts thoroughly. It's not just about knowing the definitions, but really grasping how these ideas connect and influence the bigger picture. As we progress through this presentation, keep in mind that these key points form the foundation for everything else. When we connect these ideas to the overall theme, you'll see how they reinforce the importance of strategic thinking and adaptability in our field. So, focus on these main concepts, because they'll help us navigate complex situations more effectively and make smarter decisions moving forward. Let's take a closer look at the gravity of tuberculosis, or TB. It is actually the leading killer among people living with HIV. Every day, TB claims the lives of more than 3,500 individuals. That's a staggering number, and it highlights just how deadly this disease can be. When we compare TB to other major diseases like HIV, AIDS, and malaria, the numbers become even more striking. In 2019, HIV/AIDS caused around 700,000 deaths, and malaria resulted in approximately 410,000 deaths. But in 2024, TB has been responsible for about 1.23 million deaths. That's more than the combined total of those two diseases. It really underscores the urgent need to focus on TB prevention and treatment. The key message here is simple. We can end preventable deaths by ensuring people have early access to effective TB treatment. Early diagnosis and treatment are vital to saving lives and reducing the burden of this disease. Remember, addressing TB is not just about individual health. It's about protecting entire communities and moving closer to a healthier world. HIV infection, which was once considered a death sentence, has now become a manageable health condition. With proper treatment and care, many people living with HIV can now enjoy long and healthy lives. It's a testament to how far medical advances have come. Now, moving on to tuberculosis, or TB. It remains the most common reason for hospitalization among people living with HIV. This highlights how interconnected these diseases are and why it's so important to address both effectively. One key strategy we've seen is TPT, or tuberculosis preventive therapy. TPT has proven to significantly reduce the risk of developing active TB disease in people living with HIV. In fact, it can cut the risk of death among this group by around 40%. This is a crucial point because it shows how preventative measures can save lives, reduce the burden on healthcare systems, and improve the quality of life for those affected. Overall, understanding and implementing these strategies is essential in our fight against HIV and TB, helping us move toward better health outcomes for everyone. All right, let's look at this slide. The goal here is to end tuberculosis, or TB, as a public health threat. The target we've set is to reduce the incidence to less than 10 cases per 100,000 population per year. This is a crucial benchmark because it signifies a significant decline in TB cases and moves us closer to eliminating the disease altogether. When we talk about ending TB, we're aiming for a point where TB is no longer a major public health concern in most communities. Achieving this requires sustained efforts in prevention, diagnosis, and treatment. Reaching this target not only saves lives, but also reduces the societal and economic burden of TB. It's a clear, measurable goal that guides our strategies and motivates global action. So ultimately, our shared vision is to end TB as a major health issue worldwide. Now, let's take a look at slide 13, which compares the global progress on tuberculosis with the key milestones set for 2023. As you can see, this slide provides an overview of how we're doing in relation to the targets we established. It's important because it helps us understand where we stand and what areas need more focus. The key takeaway here is whether we're on track to meet our goals or if there are gaps that require urgent attention. For example, if we look at case detection rates or treatment success rates, these indicators give us a clear picture of our progress. Connecting this to the broader theme of the presentation, it's about accountability and continuous improvement. We need to monitor these milestones closely, celebrate our successes, but also identify and address the challenges. This way, we can ensure that the global fight against TB remains effective and that we're moving closer to ending this epidemic. Let's take a closer look at this content slide. Here, I want to emphasize the key points that really matter. First, it's important to understand how these concepts fit into the bigger picture of our presentation. They serve as building blocks for the overall message we're trying to convey. When we talk about these ideas, think of them as the foundation that supports everything else. The most critical aspect is recognizing the connections between these points and the broader theme. This helps us see the relevance and how they contribute to solving the challenges we've discussed earlier. By thoroughly exploring these key ideas, you'll gain a clearer understanding of how they integrate into our overall strategy. Remember, the goal here is to grasp not just the individual points, but how they come together to drive our success. So, keep these connections in mind as we move forward. All right, let's take a closer look at this slide. Here, we're emphasizing the importance of understanding the key points thoroughly, but in a way that feels conversational. This means I want to connect with you to make complex ideas more relatable and easier to grasp. The most important concepts are highlighted to ensure they stand out, helping us focus on what truly matters. Remember, these points are not isolated. They connect to the overall theme of our presentation, reinforcing how each element fits into the bigger picture. So, as we go through this, keep in mind how these ideas interlink and support the main message we're trying to convey. Let's take a closer look at Ethiopia. As one of the most significant countries in the region, Ethiopia has a rich history and a diverse cultural landscape. It's known for its ancient roots, including being one of the earliest nations to adopt Christianity, which has deeply influenced its heritage. Economically, Ethiopia has been experiencing rapid growth, especially in sectors like agriculture, manufacturing, and services. However, it also faces challenges such as political stability and infrastructure development. Connecting this to our overall theme, Ethiopia exemplifies how historical resilience and ongoing development shape a nation's path forward in this dynamic region. Let's take a closer look at how we define TB burden and targets on a global scale. We categorize regions based on TB prevalence rates per 100,000 population. Starting with severe endemic areas, these are places where the TB rate exceeds 500 cases per 100,000 people, indicating a very high burden. Next, high endemic regions have rates between 300 and 499 per 100,000, which still represent significant challenges, but are slightly less severe. Moving down, endemic areas with rates from 100 to 299 per 100,000 show a moderate level of TB presence. Then, we have upper moderate regions, with rates between 50 and 99 per 100,000, indicating a lower but still notable burden. Further, low moderate areas have rates from 10 to 49 per 100,000, approaching low levels of TB prevalence. Low burden areas are those with fewer than 10 cases per 100,000, which is a crucial threshold because when we reach this level, we consider TB to be close to elimination. Specifically, the goal is to reduce TB incidence to less than 10 per 100,000 population per year. And ultimately, the target for elimination is set at fewer than 1 case per 100,000 annually. Understanding these categories helps us set realistic targets and tailor strategies for each region, aligning with our overall goal of ending TB globally. Let's take a closer look at the trends over the past decade. Between 2015 and 2024, the incidence of this issue declined by 27%, which is a significant improvement. On average, Ethiopia was reducing this rate by about 3% each year. However, it's important to note that the current situation has reversed this positive trend. Instead of continuing to decline, the incidence has increased again, pointing to a setback. This shift highlights how progress isn't always linear and underscores the need to understand what's causing this reversal so we can address it effectively moving forward. It reminds us that maintaining gains requires ongoing effort and vigilance. Let's take a closer look at this slide. Here, we're emphasizing the importance of understanding the key points thoroughly, but in a way that feels conversational. It's not just about presenting facts, it's about making the information engaging and relatable. Highlighting the most important concepts helps ensure that the audience grasps the core ideas without getting lost in details. Connecting these points to the overall theme of the presentation helps reinforce the message and shows how each piece fits into the bigger picture. Remember, the goal is to communicate clearly, keep the audience engaged, and make the content memorable. Today, I want to highlight a critical issue in Ethiopia's fight against tuberculosis. Despite the efforts, more than 37,000 people with TB are still being missed each year. To put that in perspective, Ethiopia's total population is around 132 million, and the TB incidence rate is approximately 141 cases per 100,000 people. While the country has reported about 150,000 TB cases, that's roughly an 80% notification rate, meaning there are still cases that go undetected. It's encouraging, though, that 90% of TB patients have documented HIV status, which helps us better understand and manage co-infections. Speaking of co-infections, 97% of TB patients with HIV are linked to antiretroviral therapy services, which is a positive step. Additionally, about 64% of newly enrolled HIV-positive individuals are put on TB preventive therapy, known as TPT, to reduce their risk of developing TB. However, the TB-HIV co-infection rate remains at around 6.6%, and sadly, TB-HIV-related deaths number around 2,400 annually. We also face challenges with multidrug-resistant TB, with 882 cases reported, underscoring the need for ongoing vigilance and treatment innovation. Overall, these figures from the 2025 National TB Program Status Update reflect both progress and gaps. It's a reminder that, while we're making strides, there's still a significant number of people missed and vulnerable, and our work must continue to close these gaps and improve outcomes across the board. Let's take a moment to reflect on why people with TB might be missing. It's a complex issue, often influenced by factors like limited access to health care, stigma, or even lack of awareness. When someone doesn't get diagnosed or treated promptly, it can be due to these barriers that prevent them from seeking help or receiving proper diagnosis. Now, what happens if this misdiagnosis continues over time? The consequences can be quite serious. Untreated TB can spread further within the community, increasing the risk for others. It can also lead to worse health outcomes for the individual, including more severe illness or even death. And from a broader perspective, ongoing missed cases undermine our efforts to control and eventually eliminate TB. So, understanding these reasons and the impacts of continued missed cases highlights the importance of early detection and intervention. It really underscores why we need targeted strategies to reach those who are slipping through the cracks. By doing so, we can save lives, reduce transmission, and move closer to ending TB as a public health threat. So let's talk about the people with TB who actually reach health facilities in Ethiopia but still aren't diagnosed or notified. That's about 17% of cases. Now, what's causing this gap? First, there are diagnosis and treatment barriers. Limited access to health services, for example, makes it hard for people to get the care they need. Then, we have issues with technical capacity. Sometimes the health facilities don't have the right tools or trained staff to identify TB effectively. Weak integration of services is another challenge. When different parts of the health system aren't working smoothly together, patients can slip through the cracks. Plus, there's often a lack of knowledge and awareness, both among health workers and the community, which hampers early detection. On the patient side, there are barriers too. Factors like stigma, economic constraints, or even logistical issues like transportation can prevent people from seeking or completing diagnosis and treatment. So, why are people with TB missing out on diagnosis and notification? It's a complex interplay of health system limitations and individual barriers. Addressing these issues is crucial if we want to close the gap and improve TB control efforts across Ethiopia. Imagine one untreated person with active TB. Within a year, they could potentially infect up to 15 other people. That's a staggering number, and it really highlights how quickly TB can spread if not properly managed. This brings us to a critical point. Ending TB in Ethiopia becomes incredibly challenging under these circumstances. If we continue to miss TB cases, if we don't diagnose and treat everyone who is infected, the cycle just keeps going. The disease keeps spreading, making eradication almost impossible. So the key takeaway here is that timely detection and treatment are absolutely essential. Otherwise, we risk losing all the progress we've made so far. This is why addressing missed cases is vital for controlling TB and ultimately ending the epidemic. Let's focus on providing correct, complete, and timely valid data. Accurate information is the backbone of effective decision-making and program management. When data is reliable, we can better understand where we stand and identify areas needing improvement. Next, we need to practice simple, affordable, and effective program implementation at the facility level. Often, the most impactful changes happen close to where care is delivered, so empowering facilities with straightforward strategies is crucial. We should also prioritize scaling up new tools and innovative approaches. These advances can significantly accelerate our progress, especially in areas like reducing new TB infections, expanding TPT provision, and managing comorbidities effectively. Improving access to screening, diagnosing, and treatment for TB remains a key focus. Ensuring that more people get tested and treated early can prevent serious outcomes and transmission. Finding missing people with TB should be a top priority too. Many individuals with TB are not yet diagnosed, so active case finding is essential to closing that gap. Additionally, providing healthcare workers and managers with updated information is vital. Knowledge keeps our teams informed and prepared to implement best practices and adapt to new strategies. Finally, for the next steps, we need to keep all these components in motion, using reliable data, adopting simple and scalable practices, embracing innovation, enhancing access, actively finding those missed cases, and ensuring our teams are well informed. Together, these actions will help us make meaningful progress toward ending TB.